This presentation, titled Predictive Model for Diabetes, was prepared as part of the HAP 709 course on healthcare databases, taught by Professor Alemi at George Mason University, Department of Health Administration and Policy. The presenter, Taylor Galownia, is a student in Health Informatics graduating in 2020. Diabetes screening is very important, for there is a large proportion of people living with undiagnosed diabetes. With appropriate diabetes screening, we can attempt to lower the number of people living with undiagnosed diabetes by applying algorithms to diagnoses already present in a patient's electronic health record, assessing their odds of diabetes. To create and test this predictive model, we used simulated data that is consistent with what would be gathered from a major healthcare organization in the United States. The dataset was large, with 829,827 unique patient IDs and 16,283,580 patient records. According to Merriam-Webster, diabetes is a variable disorder of carbohydrate metabolism caused by a combination of hereditary and environmental factors. For the predictive model, we define diabetes using CCS codes developed by the Agency for Health Research and Quality Clinical Classification System. A comprehensive set of diagnoses, including obvious, rare, and especially important diagnoses, were used in the model to predict the presence of diabetes. 3,031 diagnoses with at least 29 observations were identified, and predictors were further categorized by age and gender to uncover possible trends. The diagnoses listed above are just a few examples of obvious diagnoses that depict when a person is clearly diabetic, although not included in the definition of diabetes. Obvious diagnoses were kept in the model because they help the computer remain accurate in predicting diabetes, even the obvious cases, and also help adjust for situations when key information may be missing in a patient's medical record. Listed above are the top 10 rare diagnoses that occur more than 29 times, but less than other diagnoses. Although rare, it is important to include these diagnoses in the model because their additive effect can make an impact on predictions. This slide displays the top 10 most predictive diagnoses. These diagnoses are greatly associated with diabetes, as depicted in their calculated likelihood ratios, and therefore are very important in the predictive model. The Bayes formula shown above was used to predict the probability of an event, in this case diabetes, given the likelihood ratios. This formula allows us to aggregate multiple likelihood ratios from each individual diagnosis into one predictive metric, ultimately displaying a patient's odds of diabetes. To demonstrate this model in action, I am going to use patient with ID 6 as an example. The likelihood ratios for each of the 5 diagnoses are shown in the middle and are aggregated using the Bayes formula, calculating the odds of diabetes shown on the right. To cross-validate the data, we set aside 80% of the data set to estimate likelihood ratios and 20% for making validations, or for making predictions. In other words, the 80% is used for training and 20% is used for validation. We cross-validated the data to minimize the effect of inevitable modeling noise in the training set on predictions made with the validation set. It is also important to note here that predictors occurring after the diagnoses were ignored in the validation set of the model because the focus of the model is prediction rather than detection. A receiver operating curve is used to show the connection between the probability of detection, also called sensitivity, and the probability of a false alarm, also called 1 minus specificity, at various cutoff points. We calculate the area under the receiver operating curve to measure diagnostic accuracy, which was calculated at 0.9376 for this model, indicating an accuracy of about 93.8%. Electronic health records play an important role in predictive analytics in healthcare, as we can apply algorithms to medical history data to create models for testing. By following the steps mentioned throughout the presentation, we developed a model with 93.8% accuracy, thus creating a tool that can be used to diagnose diabetes in the real world. This concludes my presentation of predictive analytics or predictive models for diabetes. I hope you enjoyed the content. Thank you.